Here's the reality. The ambulatory EHR market has been stuck in neutral for a while now. There aren't very many greenfield opportunities, people aren't switching from one EHR to another anymore, and the number of consolidations happening in the EHR market has slowed to a trickle. So how can an EHR company be successful and grow in this type of environment? Well, that's a question I posed to Troy Wasilefsky. He's the Chief Revenue Officer at Greenway Health. And you're not going to want to miss his comment on the current EHR market and why it's primed for a shakeup. Let's get to it. Troy, welcome to the program.
Thank you very much for having me. Glad to be here.
I'm excited to be here in Tampa with you. It's exciting to be here with all your users as well. I'm sure you're very excited to.
Oh, this is a key moment. We get to talk to customers all day long, which you don't get to do all day long. So it's fabulous. Yes.
Now, before we get started, if you can, just for our audience, can you introduce yourself and tell us your role here at Greenway?
Sure. Yeah. So Troy Wasilefsky, I serve as our Chief Revenue Officer here at Greenway. And what that really means is I'm responsible really for the whole customer journey, right? From organizations deciding to work with us or add on products all the way through to serving them and supporting them throughout. And I have a great team of people who help me do that.
Well, I'm looking forward, and thank you for agreeing to sit down with me. Because
yeah, sure.
I've got some tough questions for you.
Okay, bring them on, Colin, bring them on.
I love it, So let me start with my first one. Mm-hmm. You know, the EHR market has been pretty stable, pretty mature for a while in the sense that not a lot of new greenfield opportunities.
Sure.
It's a lot of existing customers who have legacy with whatever existing provider or whatever existing solution they have.
Yeah.
So as a CRO, how do you make money in this kind of environment when people aren't switching?
Yeah. No, it's a great question, Colin. And I might suggest that you're being too kind in suggesting that the market's been stable. I think it's been stagnant.
Okay. All right.
I mean, the EHR market is one in the ambulatory space that I think has been stagnant in the sense of innovation at any sort of real scale or level. It's been complacent and frankly hasn't been serving the customers out there all that well for many, many years. How much has it really changed, right, over the past couple of years? The products that are out there, not that much. So how do you grow? How do you make money? By disrupting it with disruptive technology and disruptive solutions that can deliver an entirely different value proposition to the customers who are desperate and looking for it. I've been honored in the past in my career to have similar experiences like this, of being able to bring disruptive, innovative products to a stale and sort of sterile market, right? One where the giants are sleeping comfortably in their beds. And that's exactly what Greenway's doing, and we can talk more about that. But you know, Greenway's going to grow because we're going to disrupt the market with a completely different approach to solving ancient problems at this point that our customers and other EHR's customers have that really haven't been solved yet.
Well, let's go there since you brought it up. So you mentioned problems, and of course we hear all the time that, you know, especially in the startup world, what is the problem you're solving?
Absolutely, and I've been in that world, by the way, so I understand that well. Yes.
So, so let me ask you this. What problem is Greenway solving?
I think we're solving a bunch of age-old problems. This is substantial lack of efficiency, EHRs actually becoming a problem for clinicians as opposed to a supporting mechanism, right? I had a customer tell me the other day after seeing our new product, this is different because the EHRs were supposed to support clinicians, they control clinicians.
Ooh,
right?
I like that, okay.
So I think we're changing that concept and you know, actually allowing clinicians to solve another problem, which is spend more time with their patients. We're solving the problem of substantive revenue leakage because of the technology solutions that our providers have to use today still can't plug those gaps, or actually in many ways cause those gaps to open wider, right? So it's a big set of age-old problems. At the heart of it, though, is we want our practices to be successful, right? to earn the revenue that they deserve for the work that they do, and not let that revenue leak out. And second, we want our practitioners, the clinicians, to be able to spend more time with their patients, literally face to face, like you and I are right now, right? As opposed to having to use technology, right, in a way that doesn't actually facilitate the provision of care.
I'm going to ask you whether or not you agree with what I'm about to say, because
Yeah.
I've heard this from a number of provider organizations, whether they be ambulatory or acute,
Yep.
your customers or not your customers, but it is almost as if we're at a point where clinicians are going, we might finally be at the point
Yep.
where an EHR lives up to the promise that it
Oh.
made 20 years ago.
Yes.
Would you agree with that?
I think we are. I think that's totally right. EHR started with the right ambitions and the right concepts and the right desires and hopes, right? And somewhere along the way, that didn't materialize, right? And I think there's 100 reasons for that, but one of those, most definitively, is that the technological architecture and the technology available at the time has never allowed EHRs to do what they need to do, which is actually work in the background and get out of the way to allow providers to provide care, right, and work with their patients. And then, of course, all the other critical ancillary components of drive the revenue cycle and so forth. So I do think AI, but not just AI, because we've all been through the cycles of AI from machine learning 10, 12 years ago to the generative AI cycle and now agentic AI. Where we are today with generative AI capabilities and agentic capabilities, I would agree. I think allows organizations to create an EHR, which I'm going to put in air quotes because I think we need to change what it's called and what the definition is, right? That can do those things, fall to the background, do the work for the clinicians, for the practice managers, for the revenue cycle teams, right? And let them actually do the key work that we want them to do. I do think we're at that point, but it's a big change, right? It is a big change.
Well, speaking of big change, the company made some pretty bold announcements around the automated healthcare practice.
Yep.
It seems to be bringing together a lot of AI initiatives under one umbrella. Are you excited for this?
Oh, super excited for this. I mean, this is, I'm going to be the 400 millionth person to say this at this point, right? Like, this is a once in a lifetime, at least for the length of all of our lifetimes, right? Opportunity to embrace a completely new wave of transformative technology. And it's, like I said before, it didn't just pop into existence, though the generative AI models did, right? I mean, I think we all still are kind of recovering from ChatGPT just suddenly coming into existence one day. But this has been an evolution, right? We've seen this evolution over the past couple of decades. But it is super exciting. And it's exciting, for me, because I like to geek out a bit on the tech. So the tech is exciting and cool, right? It's exciting because you can build new things. But the thing that's really exciting at the end of the day is how transformative it can be for our customers, right? I mean, and for healthcare writ large. Healthcare's got a lot of problems, right? And the fact that technology is finally at a place, as we were just saying before, where we can allow it to do the things we've always wanted it to do, that's really exciting. And it's very exciting to be at a company who's literally embracing that full on and is going to disrupt the market with the solutions you saw today.
Now, as you look across the three pillars that Greenway is really focusing on, the patient, I'll call it the back office, the RCM side, and then the clinical side, is there one area of the three that you think the automated healthcare practice is really going to make the biggest difference in over the next 12 months?
Well, that's an unfair question because the answer is all three. But
right.
but to be fair, right? I think we're starting with the clinical workflows first, right? Because that's the piece that actually impacts the way that our clinicians can deliver care, right? So there's a tremendous value, and it's where some of the biggest burdens with today's antiquated technologies and the burnout that actually is created by those technologies, right, exist. So I think there's an opportunity to have a huge impact here on physicians' quality of life, their ability to engage with their patients in a much more meaningful way, the better capture of clinical information and driving clinical outcomes. So that's a place to start, right? The right place to start. I would argue that for practices as a business, the impact we know we can have on RCM is tremendous. I've had, again, the pleasure of working in various RCM roles over the past several years in different companies. The amount of revenue leakage that our practices are experiencing it's really a travesty, frankly. And it's got a lot of root causes, one of which, and a big one, is the fact that most of our practices are using anywhere from, well, sadly, in some cases, zero technology solutions because they're doing everything manually. And those for whom are tech-enabled, 5, 8, 10, 12 different solutions, all these handoffs, all these different systems to work in. To be able to rethink that and do that as a single platform and create a seamless way to manage your rev cycle, that is a big impact too. And that will be measured for our practice's health, right, in terms of additional reimbursement, earned reimbursement, right? But the last thing I will say, I think that drives this impact, Greenway's in a privileged position. And I say that because we are also the EHR. So having been in the world of startups before, right, if you're trying to solve revenue cycle management even as a platform for RCM, at some point you have to stop because you don't have the clinical record. You don't have all the clinical workflows, right? Same with the patient engagement side as well, right? The privileged position that Greenway's in is we are the EHR. We can approach this in a completely different way. We have all the clinical workflows, which is where it all starts, right? And what I mean by that, and you might have seen some of this in the demonstrations, take RCM, for example. When you can rethink the entire journey of the clinical practice, you don't have to think just in these buckets. We've simplified it in 3 ways because it's easy to think about it that way, but each of these blurs over one another, right? So you saw we've brought into the clinical encounter elements that traditionally are RCM because that's the place to do it. And you can rethink that whole journey in a very much more seamless, more natural way. And I think that together is going to provide a completely different impact and value to our customers.
Troy, I want to ask you this. AI, I've heard, in some cases, it's like, please give me more, at least from a customer standpoint. And then in other cases, it's just like, whoa, hold off a minute. Let me reassess. I want to see more evidence. Are you finding that you have to push or is it mostly people are pulling you in to have the conversations around AI right now?
Yeah, that's a great question. I think it's not one or the other. It's varied out there. So what I will say is like you said, there's a huge buzz about AI and its capabilities in the market. And I will say our customers are asking us for AI. That is a buzz, right? They know the power and potential of the automation and the capabilities it can bring. Now that said, what I love to hear from customers is they're asking for AI because of the outcomes it can deliver, right? So I think if you think 10 years ago, right, like people were asking for AI, but none of us knew what it even was, right? Like you didn't know what it could do. We've all become more sophisticated consumers, right? Like everybody's got ChatGPT in their pocket now, right? And so I think the market has thus become more sophisticated, and our customers know what it can give them as outcomes. So we hear both. I want AI, but I want it because I think it can do this. I want it to help me fix my revenue cycle. I want it to generate my notes for me because I know it can do that, and that's going to save me time. So I love that linkage. I think where you'd still do see a bit of a dichotomy in the give it to me now versus wait and see is natural. I think in the use cases that are more around the business, right? Revenue cycle, operational efficiencies, and so forth, there's a more I'm ready to adopt mentality. Where the AI is suggesting or being used in clinical perspectives, right? There is the right, more natural, healthy skepticism of I'm willing to use it, but I want to test it. I want to verify its outcomes, and we definitely need a human in the loop. And I think that will remain that way for a while, as it should. But I don't see it as an adoption issue. It's how am I going to use it issue? Because again, using AI for clinical considerations, that is going to require a clinical mindset to still be the human in the loop to take advantage of that properly.
One of your responsibilities as CRO is to listen to customers and what they're asking for, their demands. At the same time, you've got to balance looking at the horizon to see where the industry is going, what trends are out there. How do you balance that?
Oh, it's a great question because the balance I think is actually pretty easy in some ways, right? And by the way, this is something I do so in conjunction with our leadership team, with our product team, right? So to your point, the first and foremost thing to do is to listen to your customers, right? They're going to tell you where their problems are, where their pain points are, either with your current product, what do they want to have better, or like what are they looking for in the future? And we do a lot of that. We have a whole infrastructure here at Greenway, from customer advisory boards to functional advisory boards to events like here at Engage, where we've formalized and structured the process to receive feedback. And that is super powerful. It's the starting point. Given the transformative nature of some of these AI technologies today, right? I wouldn't necessarily call it looking at industry trends, because trends can be fads, right? We get to do something else that's really exciting, which I feel like is a responsibility to our customers, which is for us to dream the things that they might not have even thought to dream, and then present those back to them as, would this be helpful? Because this is a limitation. I remember when I started using ChatGPT myself, I'm embarrassed to say this, but I sat there at the prompt and I was like, well, what do I ask it, right? Sometimes you can't think up the future use case if you can't imagine it yet yourself. And so the way we do that is brilliant people here at Greenway, which we're lucky to have, incredible partners, our partnership with Vista, right, our private equity sponsor, our partnership today with AWS, Amazon Web Services, who are at the cutting edge of the use cases around AI. Together, we can dream some of the things that a busy clinician might not even be able to think about, but then the key is to bring that back to them and say, look what is possible, and get their feedback on that, because before it goes into a product, we need to ensure it's going to match the needs of the customers.
Troy, for all those Greenway customers who couldn't be here at the conference, what message would you like them to hear?
Great question. I think the biggest one, and I'm very earnest about this, Greenway is now a different company. And we are a different company bringing a completely new transformative solution to them. And I want them to be excited about that. Give us the chance to show that to them, for them to give us feedback. But they should expect a transformational experience with us over the next couple of months.
Troy, thank you so much for sharing all this great information. Final question, where can people go to learn more about Greenway?
Oh, yeah, well, probably the best place is greenwayhealth.com, right? Where we will be updating continuous information. As our innovation and product launches accelerate, you'll find it all there.
Amazing. Well, Troy, thank you so much for taking time out of your day to join me on the program.
Yeah, thanks, Colin. This was great.
The ambulatory EHR market may be stuck in neutral, but as you just heard Troy say, Greenway is not waiting around for the industry to shift gears on its own. They're pushing ahead with their automated healthcare practice initiative, which is really a reimagining of how technology supports rather than controls clinicians and practices. It'll be interesting to circle back with Troy to see how much progress the company has made over the next 12 months. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head over to healthcareittoday.com, where you can find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.